everybody. Dr. Rafich from Vet Triage. We are continuing on with this issue of JAVMA, June 15, 2015. We're going to be talking about the correlation between glucose concentrations in serum, plasma, and whole blood using a point-of-care glucometer and serum glucose concentration measured by an automated biochemical analyzer for dog and cat blood samples. So point-of-care glucometer is like a portable device that we can measure glucose really quick. Whereas the biochemical analyzer is a very big machine that needs calibration and is typically regarded as the gold standard for measuring values, not just glucose, but liver enzymes, kidney values, things like that. So they want to compare the accuracy of glucometer, the handheld device, versus the bigger, more complex biochemical analyzer. This study comes out of the University of Pennsylvania Vet School, as well as the Antech Laboratory in Pennsylvania. The objective is to investigate the correlation between glucose concentrations in serum, plasma, and whole blood measured by the point-of-care glucometer and serum glucose concentration measured by a biochemical analyzer. This is a prospective clinical study, which is great. Prospective is wonderful. They had 80 dogs, 65 cats, not bad numbers. You'd want more, of course, but not bad numbers there. The procedures, serum, plasma, and whole blood obtained. They measured glucose concentrations with the point-of-care glucometer, and then they compared that to serum glucose from the analyzer. Results found that for both dog and cat, the glucose concentrations in serum and plasma measured by the glucometer were correlated with the serum glucose concentrations measured by the analyzer. And that was in comparison to the whole blood. The whole blood was not an accurate correlation. The mean difference between glucose concentrations determined by the analyzer and the glucometer in serum, plasma, and whole blood were 0.4, 0.3, and 31 mg per deciliter, respectively for dogs, and then for cats it was 7, 6, and 32. So you can tell, of course, that the last number there is a larger disparity between glucometer and analyzer. Okay, introduction. The point-of-care glucometers are quick, easy, and cost-effective. They use them for diabetic patients, liver disease, sepsis, cancer, hypoadrenocorticism, which is also Addison's disease, and insulinomas. They also use them for juvenile and neonatal animals that are weak, depressed, or neurologically unstable. The point-of-care glucometer glucose concentration in whole blood has been reported to be unreliable in dogs. You can get results within 1 minute with a glucometer. You only need a small amount of blood, 0.6 microliters, and it's inexpensive to use. So those are the benefits of using glucometer. Regarding materials and methods, they had serum so the serum collection was from non-heparinized tubes, and then plasma, which were heparinized tubes, to measure glucose for the glucometer. The serum was harvested from the sample stored in an evacuated glass blood collection tubes or plastic microcontainers within 15 minutes after collection, and the serum glucose concentration was determined by the analyzer. The reference range established by the laboratory for glucose concentration in serum was 65 to 112 mg per dl for dogs, and then for cats, 67 to 168 mg per dl. And then serum concentrations of glucose below and above those range were thought as being hypo or hyperglycemia, respectively. So those are the normal ranges that they established using the analyzer as the gold standard. Results. The results showed the serum glucose concentration measured by the analyzer was considered the gold standard. For the 96 dog samples, the serum glucose concentration determined by the analyzer was within the reference range of 65 to 112 milligrams per deciliter in 73% of samples, and for the remaining 27% of samples, the glucose concentration was over 112 mg per dl. 24% of samples had a whole blood glucose concentration of less than 65 mg per dl when using the glucometer. However, none of those samples were classified as hypoglycemia based on the analyzer, and this is serum glucose concentration. For the 90 cat samples, the serum glucose concentration was determined by the analyzer within reference range for 72% of samples, and hyperglycemia in 28%. 6% of samples had a whole blood glucose that was low with the glucometer, but none of those samples were measured as low on the analyzer. The biochemical analyzer was significantly correlated with the glucose concentration measured by the glucometer, regardless of the sample, meaning serum, plasma, or whole blood. However, glucose concentrations for serum and plasma from the glucometer were way more strongly correlated with the analyzer than the whole blood samples. For the 96 dog samples, when they measured packed cell volume, so reference range for PCV or packed cell volume is 40 to 60%. 70% of dog samples so 70% of samples were less than 40% for the remaining 30% of samples. None of the samples had a PCV of over 60%. Results of the linear regression indicated that correlation between whole blood glucose concentration measured by the glucometer and the serum glucose concentration measured by the analyzer were significantly better for samples with a PCV of less than 40% compared with PCV that were in the reference range, although the coefficient of determination for the analysis was only 0.48. For the 90 cat samples, the packed cell volume was within reference range, meaning 32% to 48% for 68% of samples. And then for PCV of less than 32%, that was 30% of samples. And for those that were over 48% PCV, that was in 2% of samples. Results of linear regression did not indicate an association between packed cell volume and the correlation between whole blood glucose concentration measured by the glucometer and the serum glucose concentration measured by the analyzer when the packed cell volume was within or below the reference range. So discussion. They found excellent correlation between serum glucose concentration from the analyzer, which is gold standard, and the glucose concentrations measured by the glucometer in serum and plasma, but not in whole blood for dogs and cats. In another study in which glucose concentration was measured in 110 whole blood samples obtained from 34 dogs with various glucometers, it was estimated that inaccurate glucose concentration would cause erroneous treatment decisions from 8% to 67% of the time, depending on the glucometer used. So that means that they were inaccurate a lot, depending on the machine used. In another study, the glucometer was used to measure glucose concentration for serial whole blood samples from diabetic dogs being treated with insulin. It was estimated that contradictory recommendations for insulin was provided for the same dog on the basis of serial glucose measurements obtained on 2 consecutive days. So in this study, the results suggest that the use of a glucometer to measure glucose concentration in serum or plasma instead of whole blood does provide accurate results. In this study, all 23 dogs and 5 cats that were misclassified as hypoglycemic on the whole blood glucose measured by the glucometer was correctly classified as normal glucose on the basis of serum and plasma measured by glucometer, when the serum glucose concentrations measured by the analyzer was used as gold standard. Plasma might be the best sample for a glucometer measurement. For glucose concentration, which means that heparinized capillary tubes would be preferred over non-heparinized. Those samples with marked hyperglycemia, meaning glucose over 300 mg per dl for dogs and over 500 mg per dl for cats, was not evaluated in this study, and none of the samples had marked hypoglycemia, meaning less than 60 for dogs and less than 60 for cats. Results of another study suggested that hematocrit significantly affects the measurement of whole blood glucose concentration by a glucometer in dogs, cats, and people. In human blood samples with a low hematocrit, the whole blood glucose concentration measured by a glucometer is generally overestimated compared with the serum glucose measured by the analyzer. Although the mechanism for that finding is not understood, the viscosity of a blood sample is positively associated with its hematocrit, and some think that the ability of plasma to reach the reaction surface of the glucometer test strip is negatively associated with hematocrit, such that the amount of plasma that reaches the reaction surface of the test strip for a sample with a low hematocrit is proportionally greater than the amount of plasma that reaches the reaction strip of the test strip for a sample with a higher hematocrit. And therefore, the glucose concentration measured by glucometer will be greater for a sample with a lower hematocrit than that for the sample with a higher hematocrit. The reason that glucose concentration in serum and plasma measured by the glucometer were more strongly correlated with the serum glucose concentration measured by the analyzer than was the whole blood glucose concentration measured by glucometer in the present study might have been associated with the removal of our blood cells from plasma and from serum. A limitation of this study was that only one glucometer was used. Another limitation was they didn't evaluate marked hypo or hyperglycemia. And then finally, what the type of blood sample, capillary versus venous, was also not evaluated in this study. So for veterinarians, of course, realize that serum or plasma is preferred, especially plasma, is preferred for dogs and cats, glucose concentration measurements when you're using glucometer. And then for people, for pet owners, make sure that when you get your pet's glucose checked, when you do it at home, for example, they didn't mention that here as far as like pet owners monitoring glucose measurements at home. You are using whole blood at home, and so you have to take that into account that it may not be as accurate as if you were to collect serum or plasma. Obviously, at home you can't separate the whole blood into serum and plasma, and so you're stuck with whole blood. So it gives you a rough estimate, but it is something to consider. Also, keep in mind, like they mentioned in this paper, they only used one glucometer. They didn't compare different glucometers. So just as a pet owner, realize that although you are able to check glucose levels at home, it is not going to be as accurate as with plasma and with serum. And then for veterinarians, realize that same point, but also when you're checking values in the clinic, especially because you're trying to get like really quick samples to make sure that the pet is not hyper or hypoglycemic, the whole blood is not going to be as accurate. But again, that's only based on one glucometer. You still have to use the analyzer as a gold standard, and there are many other glucometers on the market that you could use as a veterinarian and as a pet owner at home. All right, guys, we'll see you again in the next video. Thanks so much.